This video is designed to help the healthcare professionals who need to perform a basic foot assessment for screening purposes in patients with diabetes. This video is not designed to provide information on all examination techniques, all possible abnormal findings, or advice on the management of diabetic foot problems. The assessment consists of inspecting both feet, checking the circulation, and checking the sensation. Finally, one has to ensure that the findings are recorded and acted upon if abnormal. In the inspection, we need to check the skin of both feet for any skin break that can potentially be a source of infection, such as ulcers, wounds, blisters, or fissures. One should also look for any area of bony prominence which may be at risk of damage through pressure or rubbing. Remember to check the heels and the space between the toes, since these areas may hide a skin break otherwise not apparent. The assessment of circulation focuses on the feet pulses, the dorsalis pedis on the dorsum of the foot, and the posterior tibialis on the medial side of the ankle. The dorsalis pedis usually runs between the bases of the first and second metatarsal bones. The posterior tibialis runs 1 to 3 centimeters behind and below the medial malleolus. Normally, one should be able to feel the pulses with the finger pads. The absence of the foot pulses indicates peripheral vascular disease. The most practical and reliable tool for the assessment of sensation is the monofilament 10G. This is a thin plastic hair that should be applied at a right angle onto the patient's skin until it buckles. Use the monofilament on the arch and on the plantar and dorsal aspect of the great toe. The patient should be able to feel the monofilament touching the skin. Failure to do so indicates reduced sensation, a common finding in diabetic neuropathy. Top tips. Ask the patient to close the eyes to avoid a visual bias. To recap, we are now going to show you the full assessment. Always record your findings, writing down separately the findings for each foot for inspection, circulation, and sensation. Act upon the findings as appropriate. We hope you found this video helpful. As with everything in life, practice makes it perfect.